Internews is a media development organization. We don't mention the word training anymore, but if I had to be honest, that's a lot of what we do. Or we provide guided interventions to journalists where we believe they can make a difference. And a little bit about Internews is that there have been a number of situations over the past 30 years where Internews has recognized that journalists could make a meaningful, proactive difference in a certain problem, be it health, governance, crisis situations like in Haiti, etc. So we identify gaps, and in Kenya, where I'm the country director, Internews first started in 2003. The gap that was identified at the time was Kenya had an incredibly high HIV prevalence, being, of course, in sub-Saharan Africa, and with regard to media, as you can see from this photograph, coverage was stigmatizing, it was often scientifically inaccurate, and it didn't allow a voice for the people who were HIV positive. There was a new event, a new gap in 2008 in Kenya when post-election violence gripped the entire nation and killed 2,000 people and displaced 600,000 people. The gap was that the media took sides. There was ethnically based coverage, and you may have followed the news that a journalist was in fact indicted by the International Criminal Court for the first time ever. And now in 2011, or actually longer than 2011, there has been another kind of gap. About the digital divide. This morning, Philip Thigo from Kenya really made me very proud. He's a friend of mine, and Kenya has been incredibly innovative. You heard about the iHub, you heard about all of the centers of innovation in Kenya, and that many of the applications spoken about today also have a strong presence in Kenya. But the digital divide goes bigger, is somehow a more subtle issue at the moment than the divide between have and have-nots. We saw also statistics this morning about in most of the countries listed, the developing countries listed, more than 50% of people have mobile phones, use the internet regularly. There is in fact a gap between this innovation community and journalists themselves for more than one reason, I would say. One of them relates to the fact that for a long time journalists felt threatened by this, what I now hear is being called the fifth estate. In other words, users who are becoming content creators. They felt threatened by this fifth estate. But on another very simple level, a lot of the innovations that we've hearing described today are actually difficult to understand. When Philip and other speakers today mentioned that we should remember that there are both technologists and non-technologists in the room, I thought to myself, well, most journalists are non-technologists. They're good with words, but they don't necessarily know what these technologies mean, and they report on them as an event, something that happened. iCow is an innovation in Kenya that won an international award. It was a story, a one-day story, and without actually describing what it really meant, because I believe, and I'm sorry to say that about my community, is that they didn't really understand what it did. And that's really serious when we know that all of these interventions are meant to help people, the people of Kenya, the people of the world. So the gap, first of all, has to do with the fear of innovation, and the threat, the perceived threat, which I hope to outline that if journalists overcame that threat, that they can actually be an important part of this innovation ecology. So what we have in many cases, and certainly not only in the developing world, is that journalists report on he said, she said, is the way that we always describe it in our training and in our interventions. In other words, there is journalism that simply quotes somebody from the community and then and the minister responds. Why is the hospital, somebody from the community says, we came to the hospital and there was no malaria medication, and then the minister says, it is because the consignment didn't arrive on time. So he said, she said, and sometimes they said, become the backbone of stories that ought to be based in pure science, in evidence. For instance, a story that appeared about 6 months ago by somebody who's really a very well-known journalist in Kenya and a science and health journalist in Kenya. He wrote that a baby's HIV negative test result shocked doctors. So since we're people here in the health field, what's wrong with this story? This is what we ask our journalists when we train to write on health issues. We know that without ARV intervention, without prevention of mother-to-child transmission intervention, that there is only a 30% chance of passing HIV to an unborn baby. And with interventions, it has been reduced to 1%, 1 to 2%, even in the developing world, with proper breastfeeding practices, etc. So is this really shocking? What happened is that probably the parents told the journalists that the doctor was shocked to discover that our baby was HIV positive, and the journalist simply reported, he said, it is shocking. And sometimes there are cases where, again, something is alleged by someone, there are lots of myths in many parts of the world, and somebody else simply denies that myth. But there are ways in which to overcome this, and this is where I believe journalists fit in. There was a story about a counselor in central Kenya, which is one of the provinces in Kenya, who was bemoaning the fact that his people were having too few babies. So the counselor said, well, it's a real problem. This is a much longer story. I've simply extracted the part that I wanted to highlight today. He said that the thinning population in central province must be because of poverty and because of alcoholism. So men are alcoholics, and therefore they're not making enough babies. Whether he meant impotence or whether he meant that they didn't have the time, he didn't really say. So naturally, this kind of reporting has big impact in a country like Kenya. Recent surveys have shown that people say that it must be true, I heard it on the radio. It is true, I read it in the newspaper. So in this newspaper, which is a very influential newspaper in Kenya, a story is produced, it is read, yes, it is still legacy media, but it is read by policymakers, and it is read by many people who say, okay, so alcoholism is a problem in central Kenya. But meanwhile, we knew that there is fantastic data available from the Kenya Demographic Health Survey, which is something that appears every 4 years. And in trying to help journalists with this intervention about how health journalism can be about facts and science and accurate interventions, I met a wonderful woman who is passionate about making data available via the conduit that is journalists to ordinary people who need to understand these issues. Her name is Angela Gashui, and she became interested in this issue after her father died of cancer 3 months ago. She is an innovator herself. She has been aware of the wealth of data now available in Kenya, but what she didn't know is that a tiny fraction of health expenditure in Kenya is allocated to cancer. Most spending is allocated to communicable diseases, and therefore, when she found out what that percentage was, she became so passionate about accessing data and about appealing to decision makers and making this knowledge available to the general population about how knowing what something is helps you, empowers you to work on how that might be changed. So here's Angela on this story.
So when I read this very interesting and topical article, well, it was very clear that there are two perspectives that came out where the counselor was clear that it was about alcohol and poverty. But I immediately asked myself what would happen if somebody was actually able to mine some data, if journalists actually had gone in and mined the data to find out whether this was actually true. Would the story have come out any different? So I went online and was able to get access to the Kenya Demographic and Health Survey 2008-2009. And interestingly enough, as you can see here, Central Province is second in the country with a 95.3% literacy rate for women, just short of the Nairobi level, which is at 95.8%. So interestingly enough, it shows us that we have very, very highly educated and literate women in Central Province. So then we quickly went and looked throughout the same survey, the Kenya Demographic and Health Survey, to see whether there was any data or statistics on the use of contraceptives in Central Kenya. And lo and behold, we found that Central Kenya actually has the highest prevalence of contraceptive use among married women at 67% in comparison with Nairobi, which is the capital city, at 55%. So it then, really asks the question, is it truly poverty? Is it truly alcohol use and prevalence in Central Kenya that is causing there to be a reduction in availability of school-going children? Or is it something else like an increased level of education and literacy and therefore also an increase in the use of contraceptives among the women in Central Kenya?
So we thought if journalists knew how to access the data, a completely different story would have come about. It's not a story about poverty and alcohol. It's a story about high literacy levels in that region and about the family planning initiative, which has been broad and extensive in Kenya, is taken up best by women from that province because they're the most illiterate. We know there's a correlation. You heard mentioned this morning, and when Angela spoke about it, about the Kenya Open Data Initiative. Kenya is one of 10 countries being acknowledged by the United Nations in a special session that will be held later in September about transparency and open data access. As it happens, the two health departments in Kenya now, by the way, because Kenya had a coalition government, there are actually two health departments. There's a Ministry of Health and there's a Ministry of Public Health and Sanitation. So the one, as you can imagine, deals with communicable diseases and the other with the rest. So both those ministries have their data up on this website, which, by the way, was an international story, reported in Time magazine, reported in New Scientist, reported in The Guardian and publications here in the UK, but actually only as a happening in Kenya. And this is why I mentioned that there's a gap and that Internews wishes to respond to that gap. So the Kenya Open Data Initiative was launched in July by the President and by a very proactive Public Secretary of Information called Bitange Ndemo. Okay, with access to this data, the story about the women might read differently. That there's a trend about smaller families in Central Province because of the high uptake.
So for the first time on the continent, journalists now are actually able to gain access to government-vetted data. Data that has been provided to them by the government and opened it up, because in July 2011, the government of Kenya launched the Kenya Open Data Initiative, which is, as I mentioned, the first of its kind on the continent. It's a wonderful initiative that makes public government data accessible to the people of Kenya. In this instance specifically, it's very, very useful for the journalist community and the media community at large, who are now able to vet and validate and just add another level of depth and accuracy to the stories that they're reporting, because the data is actually available.
With the gap that we perceived, we see that journalists not only don't report accurately and enthusiastically enough about the innovations available, but they're not aware of what's available online in terms of data that will make their stories credible, will give it far more meat, and will make them part of, this innovation community. So we're moving in with assisting journalists on this data mining. There are a lot of exciting visualization tools that make it possible for a layperson, for a words person, to understand what the data means. Because, the squiggles and the numbers that we see even on the Kenya Open Data Initiative don't really make us understand it. But the visualization tools that then applied to the open data actually points out health stories to journalists. They need to learn how to do digital production, how to publish digitally, and very importantly, to incorporate user-generated content. What journalists perceived as a threat, i.e. the crowd, the people who comment, the people who contribute on Facebook and other social media, actually their comments need to be curated, need to be cut and pasted into their stories and then analyzed, because that's the unique attribute that journalists have, is they can analyze these comments and realize what it is that the community out there is saying. So they'll mine the data, and therefore we'll hope to close the gap. Thank you.